I'm talking today with Orion Bell, President and Chief Executive Officer of the Benjamin Rose Institute on Aging. Good afternoon, Orion.
Good afternoon. Thanks for having me.
You?
Good, good.
And you had a nice weekend, I hope?
We had a beautiful weekend here in Cleveland. It's like spring is really here. So
spring is in Cleveland.
Yes.
It's wonderful.
Yeah.
Well, spring is here in Tampa Bay too, but of course, spring is never gone. So we don't notice it much. We are talking today about how Orion, as CEO of Benjamin Rose, handles stakeholder relations. Why don't we begin by you telling us a bit, Orion, about your professional experience and about the Benjamin Rose Institute?
Great. Well, Doug, I've worked in the nonprofit sector my whole career. I spent the first 20 years or so working with the American Red Cross in various locations and had a lot of opportunity for community programming within that. And always kind of drawn into services that included family supports and paratransit programs and other activities. I grew up in a household with a brother with developmental disabilities. And Daniel grew up at home back when that wasn't all that common. And I think that has made me aware and maybe more empathetic around the challenges for people, for older adults and for their family caregivers and for people with disabilities, and that effort to stay in the community and be involved in a community setting and have so after Red Cross, I was involved in the Aging Network in Indiana and served in a variety of posts outside of my normal job responsibilities there, including service on a national board of the National Association of Area Agencies on Aging. And so when the opportunity came to come to Benjamin Rose, I knew about the Benjamin Rose organization as a customer of theirs and as someone who had seen the value of their work and had used some of the programming in my community. And Benjamin Rose is in a unique situation, and it's a rare organization that combines direct services for older adults and caregivers with applied research in programs all around the country, as well as a role in advocacy. We're a nonprofit organization, not a direct government agency, and not directly funded by the government in many of our programs. So we're in a unique position to be able to deliver services, but also to evaluate and review and recommend programming based on our experience locally and then in communities all across the country. So it's a great organization with a great history, and it was a real thrill to be able to come here.
So how many employees do you have, and what's your annual budget?
So Benjamin Rose has about 150 employees of its own. Operating budget this year is around $17 million across several programs. Most of our direct services happen here in the Cleveland area, but then we have about 60 sites around the country where some of our caregiver support programs are delivered under license through our organization. So some of our customers are state governments, local area agency on aging programs, health systems, health plans that use some of our programming. But most of our staff is based here in Cleveland, and primarily folks that come out of the social services or social work background, either as direct service providers or as researchers.
So, well, thank you for that briefing. Our subject today is stakeholder relations. What are 5 or 6 external organizations that you consider really high priority stakeholders that you as CEO should pay close attention to? How did you choose them? What criteria did you apply?
So with our organization, I think there's a couple of obvious stakeholders, and there's a couple others that maybe wouldn't come to mind right away as being an obvious stakeholder. But clearly our connection with the Aging Network, with other organizations that provide services for older adults and the related programming around that. So for example, our local area agency on aging would be a valuable partner in that, both as a funder, but also as a planner and coordinator of services for programs in the community. The healthcare systems. We have 3 very large healthcare systems here in Greater Cleveland that have significant commitments to aging services and geriatrics care. We have a lot of longstanding partnerships with them in programming and service delivery. So in particular, some of the leadership in the geriatrics program at the Cleveland Clinic or the University Health System or Metro Health, where we have projects as well. And so people within those organizations, particularly the folks who are in the geriatrics medicine area, because of the interest in social determinants of health and the opportunity for us, because we're not a medical provider, but we provide supports for their patients and their clients and their families. So those are a couple obvious ones. And then maybe one or two that maybe don't seem quite as obvious, but there's a lot of what we do that's very much about neighborhood development and community development. So organizations that are involved in the community development planning in areas, the community development corporations that might serve a redeveloping neighborhood that's trying to reestablish its business sector or its housing component, or the state legislators and state government officials that we might be in their district or in a district next to them. And their interest and our interest in them is in part because the folks that we serve are affected by policy and regulation. Things like insurance plans are regulated at a state level. So, knowing the folks in the state government, both the elected officials and the folks that lead those state agencies, they have a lot to say about the rules and regs that affect the population that we serve. And in talking about our organization, very much that it is a community-driven program because services for older adults happen in community settings. And for that to happen, there has to be community. So it's important for us to be a part of those conversations with organizations that are about quality of life issues or livability issues, who may not necessarily see themselves as seniors serving, but we're interested in the same things. The walkability of a neighborhood, the availability of shopping nearby, the amenities that people can take advantage of, like transportation or parks or library systems, those sort of things. All of those people become stakeholders of the organization. And for me, in kind of seeking some of those folks out as a pretty new CEO in the community, one of the things I heard from my board members was a desire to raise the profile of the organization locally. I said, at the outset that we have a great reputation nationally in the aging sphere.
That you do.
But not everybody locally knows about us. And so part of my task in thinking about stakeholders to engage with were those folks that would help us build our presence and build our profile and build our connections in the local community, just like we have those relationships all around the country.
So let's drill down. You've mentioned some key stakeholders. Tell us what strategies you've employed to manage these relationships and give some concrete examples, if you would.
A great example is one of the state officials here, elected officials, his name is David Greenspan. And David's been in office in Ohio. He represents the district, not the one I live in, but he has an interest in aging issues, and he's nearby. And he has an interest in the Benjamin Rose Institute because of his advocacy for people in his neighborhood and the people that he serves and the families that are in that area. Like a lot of Northeast Ohio, he has a district that includes a significant number of older adults. And David is one of those elected officials that say he's in a purple district. It's not always Republican, it's not always Democrat. So he's very attuned to constituent relations and things that are important to the folks that elect him. That makes him a great legislator generally, but he also has an interest in aging services. So he was one of the first people I got to meet when I came to Cleveland. I had a list of folks that I should try to reach out to, and his name was on there. My predecessor was good about networking and leaving a list behind. And so we chatted some, and I met with him, and we scheduled a time and we got together for coffee and we talked about issues, and I thanked him for his past support of the programming we're involved in, and I thanked him for his interest in it, because we might not agree on everything, but he has an interest in the population, and you thank people for that, and you look for the reasons to be grateful for the things that they've done for you. And he knew about our organization, and he sometimes asked us for input. What do you think about this? Or I'm hearing this. What's your perspective on that? And having that opportunity, because we're not the public entity, we're not the government official, but we do represent constituents that are served by him as well. And so I think that there has some value there. And so that first meeting, he gave me some advice about other people I should talk to. So I made a point of introducing myself to them. And the next time I saw him, I could circle back and say, hey, Dave, you recommend I talk to so-and-so? And I said, hey, we met and we talked about this and we worked on that together. And our paths cross from time to time because of other regional interest in things like mental health services or community development programming or aging issues. And so I'll see him at meetings, and I'll make a point of just going and checking in and touching base and subscribing to his newsletter and all of those kinds of activities as a piece of it. And then kind of digging into the deeper level, just as an example of this, one of the activities that the older adults do at our senior centers is there's a state house day where they'll go to the legislature and advocate for things that are important to them at the state level. And, so I know who from our group went, and I knew who they met with. And so a day or so after they had been to the State House in Columbus, I sent a note to those legislators and say, well, thank you for meeting with our folks who came from Cleveland on this day. Appreciate you taking the time to meet with them, and thank you for your support. Just to make those kind of connections. And I found that not just with David, who I'd met before, but even with some of the others that I had not met previously, that prompted a follow-up call or some interest, just that level of engagement. That networking happens at all levels. And I say, I don't live in his district, but some of the people I serve do. And some of the people in the caucus that he works with do. And so there's just opportunities to be helpful, and I can be beneficial to him as good constituent services. He can be helpful to me by being a voice that listens to us when he's in the state and state government. So that's one example of kind of working a relationship within that. So a more local example is, I mentioned one that maybe doesn't come to mind right away, would be the community development programs. So, we're a senior serving agency, we're a local nonprofit, but we're also an employer. We're a property owner. We own an apartment building in the Cleveland Heights area. We own the headquarters building where I'm sitting, which houses most of our staff resources. We have tenant programs where we're a tenant in 9 other facilities around Greater Cleveland because of the senior center that we operate in a location. So one of the folks that we wanted to, develop a stronger relationship with was the Community Development Corporation that has developed University Circle, which is where Case Western University is. And our building is not in the circle, but you can see it from there. And we have this long-standing relationship with the university and with the students from the university, and there's campus housing right next door to our building, and there's faculty that lives in the neighborhood where we are. And so opportunities to meet with them and talk about development plans, because as a As an organization with roots in the community and a commitment to be intentionally in Cleveland, we're interested in the development of those places, both for our own interest as a landlord or a tenant or a property owner, but also in those of our constituents, because many of our clients that use the meal program or live in one of our apartments or take part in some of our other services are residents of those neighborhoods. And as we think about being community placed, well, you got to be in that community and know about it, and you want to be a part of the community. So I don't want him just to think about me as those folks who work with the seniors. I want him to also think about us as somebody that would have an interest in a new building development that's happening, or a discussion around where the sidewalks are, or the length of the crosswalk as you are in that area. You know, all those kinds of conversations that are about quality of life issues, not specific to seniors, but part of the message there can be, you know, we all want the same thing. We're all interested in walkability and livability and the safety of the streets and all those kinds of resources. So as they have planning meetings and discussions, as they vet new projects, you know, we want to be one of the people they talk to. And so it's an opportunity to pick up the phone, go take the tour, you know, have coffee and talk about what's happening. Take a look at plans for redevelopment of a building in an area. And we may not be part of that project, but we might serve the people who benefit from it. And so having those conversations, again, looking for the thing we have in common is so important.
You've been at Benjamin Rose now a year or so?
Been about a year, right.
About a year. Have you had time to join any boards in Greater Cleveland?
So there's a couple of organizations that just by being the CEO at Benjamin Rose, I would be involved in. There's a group here called the Center for Community Solutions, and one of their projects is the Committee on Older Persons.
Oh, well, that's your cup of tea.
I would have a hard time not being on that board. There's a community project here called Fair Hill Partners that Benjamin Rose had a role in developing with the University Hospital System a number of years ago. And that's a board that's just sort of, it would be odd if I wasn't participating in that board. So those are a couple of natural ones. I've also explored the opportunities to be involved with Leadership Greater Cleveland and those kinds of entities. I joined in with the Block Watch in the Block group in my neighborhood. Cleveland is very much a city of neighborhoods, and most neighborhoods have a block party that is. But that's where I run into my city councilman most often. That's where I learn about the developments that are happening, and I live in one of those neighborhoods where most of the longtime residents have been there a very long time. And they are older adults who might look to us as a service provider. So, you know, those are some that I've had an opportunity to have a role in, and there will be others. Joining one of the civic clubs here and getting involved in that way, because there's community service opportunities that happen through that, and in addition to the networking things that occur.
So how much time do you estimate you spend on the average, let's say weekly, in maintaining stakeholder relations? You
know, I think in the CEO's role, it's at least half of your time, sometimes more. And I think it becomes more external. Those external stakeholders become more of your time the longer you're in place. I'm very much aware that in the first 3 months, 6 months of coming into the role here, you know, the stakeholders I had to meet first was my own staff, our own consumers, our own donors, our board members, right? So those are more internal supports.
Right.
But in many ways, the role of the chief executive is to be the face of the organization, to be out in the community and connecting with those other providers and other programs. And so I would say it's at least half, and probably as I'd say years of experience is there. It probably is closer to 2/3 to 3/4 of your time is spent in those external relationships, making that connection with your peer in those other organizations, or getting involved in those community projects that are meaningful to me or meaningful to the organization. I think you're never really off duty.
That's right. You're always on stage.
You're always somewhere. And
right.
So even a lot of your social engagements are opportunities to network and connect, because, what's the first bit of small talk is, well, what do you do? And very often that might be the first introduction that somebody has to the organization.
BRI. Yeah. Well, I'm assuming you enjoy the external dimension of your role.
I do. It's a great story to tell, and even when you're pretty new, you should have a good story to tell. You should know something about the organization and if you found it interesting, other people probably will as well. But something about one of your clients, something about one of your volunteers that resonates with people. In my experience here, one of the great stories for me was, as I learned about the history of the organization, finding out about Sid Katz, who was a physician who worked here, and when he retired was in residence here for the rest of his life. And if you work in aging services, there's this model called an Activities of Daily Living Scale, ADLs. And that anybody in aging services, if you evaluate people for nursing home placement or their safety to live independently, you talk about ADLs. Well, Dr. Katz invented that scale when he was part of Benjamin Rose early in his medical career. And to me, that was just one of the coolest things I ever saw. Well, I've used that forever, and I never really thought about where it came from, and it came from here.
And a good story to share.
And right? A great story about the connections with this community and higher education in this community and healthcare in this community, and somebody who in his retirement continued to carry that forward. And work in an aging services organization, what better thing can you say about it to have somebody who worked in his career, and then when he retired, loved it so much he came back and continued doing it here. And that's been one of the ways that I have met other people in healthcare in this community. I've met people that were trained by him from all over the country. And so that's just one example of one of those stories. But every organization has a story or two or five. I mean, there's something in there that you can find and tell that's yours. And with our board members, we encourage that too. To find a story. My board chair likes to talk about the wow story, and encourages people to share those at a board meeting, and to help tell those and replicate those.
So speaking of your board, tell us more about how your board's engaged in this area of stakeholder relations.
So one of the ways that, especially somebody who's new to the Cleveland area, that board members were really important in making those introductions to places. I mentioned the University Circle area. Well, the board chair had served on that board previously, and so you should go meet this one. You should meet him. Here's his number. Tell him I said call you. Those kind of things that you want your board members to help you do, and you ask them to help you do that. We have a couple things that I've done here to help facilitate some of that. We develop a board grid of activities that we ask people to do, and some of that's you're going to come to board meetings and you're going to be a donor. But there's also things on there too, like I'm going to go do a home visit with one of your social workers. I want to go on a route with a meals driver. I want to invite a friend to an event. We set up a monthly, we call ours Second Wednesdays, but every month we just do a little sort of a show and tell of the organization where we invite a group of people from the community in for a light breakfast and talk about the services and the issues that are important to us and affecting older adults. And that's partly a development tool, but one of the best things about it is it's something I can ask with my board members to say, you know, if you want to invite somebody to that, you know, maybe you're not comfortable making the ask, maybe you don't feel like you know enough about the organization, just bring somebody to breakfast and we'll talk about it there. And so that's been a way for people to be engaged. You look for an easy access point. You look for something that people can do that is painless, and you want them to walk away from it going, you know, that wasn't as scary as I thought it might be, or that was more fun than I thought it would be. And particularly as it is around stakeholder involvement and engagement and fundraising. Because the most credible person, if I can have a board member say the thing in public that needs to be said, it carries so much more credibility when my volunteer says it as opposed to me saying it. You know, I'm the paid hack. Of course, I'm going to think it's a great thing. But
well, we wouldn't call you a hack.
But when your volunteer who does this because they want to,
right,
it's a passion of theirs, and they share it, there is a credibility in that you just can't buy. And
well, do you maintain a kind of board speakers bureau? Do you book board members?
We have several who like to do that kind of activity and will do that. And that's one of the things we ask people about in terms of their areas of interest. Mm-hmm. You know, are you comfortable speaking or making those kind of invitations? And some people are. And also make a point of having a regular communication with them, kind of feed some of those stories out for people in those less formal settings. We do so I call it a board week. It's just an email that goes out from me every week to all the members of the board. And it's not a newsletter, and it's not something that's produced out of the communications department. It's an email from me. And it might have a link in it to a website I think they would be interested in. It might have a photograph in it. It might have a mention of a donation that was just recently made or a project that was just completed. But something that's just a regular reminder of what's happening. Because part of the purpose of it is to remind people that, hey, you're on the board, you know, and you're on the board between board meetings. It's not just that formal meeting that's there, it's all the other opportunities that happens. And so, you know, having that as a regular piece, having that scheduled breakfast time each month where we can have a conversation with folks, you know, having those things scheduled and on a regular basis and say, hey, if you want to participate, here's an easy way to be involved. And I think that's usually the tripping point for people. Is I want to help. I don't always know what to do. Help me understand what to do. And so give them a couple of concrete things that they can do and that they can see on a regular basis. And I found that's been a wonderful tool for developing understanding and support with stakeholders.
Now, you'll be pleased to know we've arrived at my last question. So you can get back to work fairly soon. But Orion, what would you tell your CEO colleagues around the country are the preeminent keys to success in handling stakeholder relations? What's your counsel to your peers?
Yeah, I think if you're in that CEO's role, and you obviously have a connection and a commitment to the mission of the organization, and that drives all the other conversations. You know, I think the affiliation and getting together with people is one of the most exciting things about the work, and that you look for reason, find something in common, a common interest, a common goal, a common understanding. Now, I've done a lot of advocacy around transportation issues. I've been on the board of a transit authority. I've worked on a number of ballot initiatives about getting public funding for transit on a ballot. Some of them worked, some of them didn't.
Were you on the board of Indigo?
Not of Indigo, but I did work with Indigo on a project of theirs that just recently funded the expansion of the transit system.
For our viewers, Indigo is the Indianapolis transit system.
Yeah. And and my interest in that is because I have a lot of experience in delivering paratransit service, which is the supplemental service, because that's something aging services agencies do. And I have an interest in it because I've seen the value of it and the benefit of it and kind of working in that space. And it's one of those projects that's not specifically about older adults, but older adults and people with disabilities benefit from it. And people that don't drive, for whatever reason, benefit from it. And, so that's a great example of looking for those other people that have a common interest with you, and that those people are stakeholders and partners. And yes, the AARP was active in that effort. And yes, the transit authority people were there. And the council members in that city that were part of where the route was going to go had an interest in it. But there were also people there from the Council of Churches, and there were people there from the Prevent Blindness group there, and the Easter Seals and other folks, because their folks were interested in that issue as well. And I found similarly around things like hunger is another one of those great unifiers, or conversations around caregiving. So for me, it was finding those things that resonated, not just because of my interest in aging services, but things that resonated with people because it touched their lives another way. And you go to those events and you see who's there and you find out why they're there and you learn what you have in common and you go from there. And most of the time, we have a lot more in common than we have in competition. And your collaborators can be your partners instead of your competitors. And your funding proposals to grant makers are always stronger when they're community efforts. And those proposals are always better if they didn't start with the grant application, if they started with that thing you found in common. I learned that from one of my colleagues that did a regular symposium around dementia services. And he's a physician, but his focus on it was he invited everybody. He had people with dementia and their family members and service providers and teaching faculty and people from the pharmaceutical company. And we'd get together over dinner and talk about stuff. And the number of innovative ideas that came out of that and the number of business opportunities that came out of that for my organization, but also for a lot of others, was pretty remarkable, because it was never a business plan, but the business plans came out of it. And so I always look for those kinds of collaborative opportunities across sectors that may or may not specifically be about aging, which is my particular.
So you're always looking for ways to connect.
It never stops.
Never stops.
And so.
And should never stop, I assume, is what you're saying.
Yeah.
If you're CEO.
Well,
anywhere in the job,
right?
Yeah.
It's all part of the job. So we're all of us are in sales, right? So you're always
right.
pitching your organization and the mission. It's important to you, and it comes naturally. And you're storytellers. And if you'd asked me 30 years ago about sales, I don't want to do sales, but it's storytelling. And especially in the nonprofit arena, you're telling people about your mission. You're giving them an illustration of what you do and why it matters. And you can always do that.
Well, folks, I've been talking with Orion Bell, President and CEO of the Benjamin Rose Institute on Aging, a nationally known, prestigious nonprofit. I want to thank you, Orion, for taking the time from what I know is a terribly busy schedule to tell us about BRI and about your role in stakeholder relations. So thank you very much.